Bismillahirrahmanirrahim. Assalamu alaikum, viewers. We are discussing about the teaching and learning theories, in which we are discussing the different perspective of the scholars. In the last session, we had reviewed the basic concept of the cognitive theory, the behavioral theory, and the social learning theories. So, today we will discuss the last two theories, that is called the psychodynamic theory and the behaviorist theories. First of all, we are thankful that uh, your people have subscribing our theoretical nursing channel for understanding the core concept. The aim of this channel is to inform or orient the audience about the basic concept, our discipline knowledge, or the roots, theoretical roots of nursing. So in today's session, we'll discuss about the psychodynamic learning theory. Psychodynamic learning theory is basically focus on motivation and emotion aspect. As we had discussed, that the psychosocial theory was uh, based on the social interaction. The behaviors theories was focused on the stimulus and response. So this theory is also called the theory of motivation, that stressing upon emotion rather than the cognition and response. uh, Basically, in the last three theories, we discussed that the cognitive theory is focusing on the cognition, that is the mental processes or thought process, and the behaviorist theories was based on the responses, the stimulus, and then the response process principle. So the psychodynamic theory is based on the principle of motivation and emotion. The psychodynamic perspective emphasizes the importance of the conscious and the unconscious forces and guiding the behavior, like personality, conflict, and the enduring effect of the childhood experience, like how was the kid experience and their childhood, and how his personality evolved, uh, their past experiences basically affect their emotion and motivation that uh, influence their learning process. So this theory was developed by Sigmund Freud. The principle of the theory is basically the behavior may be conscious or unconscious. So that is, individual may or may not be aware of their motivation and why they feel, think, and act as they do. According to psychodynamic perspective, the most primitive sources of motivation, how the individual motivate, basically comes from the id. Id is basically a, uh, based on a libidinal energy that is innate, and we receive by nature. The basic instinct or impulses and desire we receive by birth, which include two type, like eros and thanatos. So eros is basically a concept, uh, is actually the desire uh, for pleasure. Sometimes call it the life force. While thanato is the aggressive or the destructive impulses or the death wish that is innate by nature, receive um, and affected by their emotional motivation and their past experiences. So if a person had a bad experience and bad past experience at their childhood, so he will develop the thanatos, whereas and contrary, uh, he will develop the behavior like erodes the desire for pleasures of the life force. So he will be motivated. So this theory is basically focused on motivation and emotion that he or she is received by birth. So the psychodynamic theory will be explained by example, like the id, as we had discussed. It is innate, the libidinal energy basically operate on the basis of the pleasure principle, as we had discussed, to seek pleasure or avoid pain. Like the dry and dull lecture given by the faculty member or the helper patient who go through the motions of presentation without much enthusiasm or emotion, inspire few patient or audience to listen or heed the advice. Like faculty member key example uh, discuss or they're discussing about the teacher strategy. The teacher is discussing taking adult class and they're not using the different strategies, multiple strategies, by using only one strategies to different audience, so the student will not be motivated and not taking interest, their learning will affect. The id, as we had discussed, is a primitive drive that we receive by birth. Another concept is the super ego. Super ego is the internalized societal values or a standard that is said that men are stronger. Um, um, these are the basically the myths that and a standard that is set by the society or the culture, affecting our learning and our motivation. So id and super ego, the internal standard of the society, and ig, the primary drive we receive by birth, affect uh, are mediated by the ego. Ego is basically operate on the basis of the reality principle. What is reality principle? What is in the reality? The orientation of the reality that exists at that time. For example, a patient with ego strength, a good ego strength can cope with painful medical treatment. With the poor ego strength, he may not be able to mm, cope with the painful treatment. When the ego, Sigmund Freud have mentioned that when the ego is threatened, there is some condition that threaten the ego can easily occur in the healthcare setting usually. So the defense mechanism may be employed to protect themselves. So the defense mechanism using by the individual when the ego is uh, at the threatened end, like the id, the super ego, the internalized societal values or standard. When these principles are threatened, so that is part of the ego. So then the defense mechanism is um, started by the individual. These defense mechanisms are for short-term use, and it is a way of coming to grasp with that reality in which he or she is feeling with. Like the example, I will explain this by with example, like the defense mechanism in the healthcare setting. We can give the example of the Kubler-Ross stages, in which he pointed out that many terminally ill patients, in an initial reaction to being told that they are seriously ill, and so their first reaction is denial. Like there's a condition in which the death news or the bad news always responded by the denial in the first encounter. So there is the perspective, like denial is a mechanism used by the individual while avoiding that bad news. So here are a few of the defense mechanism. Defense mechanism basically are the way of protecting the self from the perceived threat. The perceived threat is the death news or the bad news or the news of the serious illness, like the diagnosis of the cancer or the serious heart disease or life-threatening condition. Are basically the perceived threat that affect the ego of a person, and then ego is when threatened, so then the person start defending by using certain mechanisms. So these are a few of the mechanisms. Like I have given the example of Kubler-Ross model, in which exposing the person to the bad news, so the person starting denial in the initial stage. There is another example of rationalization, displacement, uh, regression, and repression. So these are one of the topic of our VLAG that we will discuss these defense mechanism in detail. But now come to the topic. So this was the basic concept of the psychodynamic theory that is based on motivation. The last theory of this session is the humanistic learning theory. Humanistic perspective on the learning is basically the assumption that each individual is unique and that all individuals have a desire to grow in a positive way. So, unfortunately, these positive psychological growth may be damaged by some of the societal values or standard and expectation, the myths, like as I have mentioned, that males are less emotional than female, or some ethnic group are inferior to others. Another myth is like making money is more important than caring for people. So these are the social standards that affect of the individual life, like positive way to grow uh, by himself. So like the previous theory and the humanistic theory are also based on the emotional aspect, and the basic concept of this theory is spontaneity. Spontaneity is basically the importance of emotion and feeling, the right of individual to make their own choices, and human creativity are the cornerstone of a humanistic approach to learning. So like the psychodynamic theory, the humanistic perspective is largely based on motivational theories and encountering that social standard or myths, like men are stronger and male are less emotional than female. So while countering these myths, the humanistic perspective um, developed, like in which they have mentioned that the individual have a desire to grow in a positive way, and this positive way are affected by these social standard or cultural variables. So the spontaneity explain the importance of the emotion and feeling of the individual. So from the humanistic perspective, the motivation is derived from each person's need, how the person uh, uh, having the needs. Our needs are the subjective feeling about the self and the desire to grow. So these needs as individual are self focused, like in which uh, he or she want to grow um, alone, uh, avoiding the social aspect, like the social myths. So the therapist Carl Roger urged that what people want is unconditional positive self-regard. That unconditional positive self-regard is basically the feeling of being loved without string attached. So the behaviorist uh, theory, the psychodynamic theory, uh, both of these theory was mainly focused on motivation um, and emotional aspects. So this all these were the five theories or different perspectives that were given by the scholar about the learning process, and these different perspective can affect the individual learning processes. Thank you for your kind lesson.